Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today, I have Dr. Carmen Byker Shanks.
Thanks for having me on the podcast, and always good to chat with you. So I currently serve as Director of Scientific Strategy at the Center for Nutrition and Health Impact. And I have a background as a tenured professor at Montana State University and worked there for 10 years, but now I'm solely with the Center for Nutrition and Health Impact. And I really work on translating research evidence into scalable solutions with different communities across the nation. And I work on like innovative pilots to large multi-year programs such as the GusNIP program. So yeah, I'm excited to bring that work in here. I'm a trained registered dietitian, a nutritionist as well. So just excited to bring it all together on this great podcast.
Okay, fantastic. Your article discusses why the Vegimeter is important and what are your reasons for wanting to study this device related to fruit and vegetable intake?
Yeah, so I'm happy to be here to talk about the article, and really the focus of the article was understanding the use of the Vegimeter in community settings specifically, and what that means for practice as well for policy. Just to kick things off very quickly, for those who don't know what the Vegimeter is, it's a non-invasive device that uses reflection spectroscopy to estimate skin carotenoid levels, which serve as a proxy for fruit and vegetable intake. I'll break that down in a few ways. First, what is reflection spectroscopy? It's a non-invasive optical technique that it basically shines a light onto skin and measures the light that is reflected back. And the pattern of reflected light depends on the skin's chemical composition. So the Vegimeter is a device that basically uses this technology on a finger, and it's used to estimate carotenoid levels in the skin. And many of the listeners will know that carotenoids come from fruits and vegetables. So higher carotenoid levels in the measurement in this device generally indicate higher fruit and vegetable intake. And so the device translates the reflected light signals into numerical reading that serves as a biomarker. And the device itself gives the participant a range that their skin carotenoids are reflecting, and it gives a reading back to the researcher as well as the participant. So a lot of times it's used in research that targets fruit and vegetable intake or healthy food consumption in some way, to look at where are participants at baseline versus after an intervention, or sometimes it's used as a piece of education for a patient or participant around what their skin carotenoids are and how they could increase their fruit and vegetable intake or their dietary quality. And so it's a useful tool to screen populations, and it's been also used to measure change from interventions. That's not a blood draw, and it can be used in a community setting, and many times is used in a community setting. And it's very quick, easy, practical, and it's less burdensome than like having someone come to a lab and doing a blood draw. So these devices have been adopted into some community-based programs for use at like farmers markets, schools, grocery stores, or in a community health fair. And we at the center have, seen this being used across a lot of different projects. And one of those projects is within our work as the GusNIP NTAE. We're a technical assistance and evaluation center for nutrition incentive and produce prescription projects across the United States. And we have had a lot of questions when developing evaluations or setting up technical assistance for community-based projects about, would the Vegimeter be a good thing for me to use? How do I adapt it and use it for my my setting, because a lot of the literature as well as the protocols are very much more controlled settings. And if you've ever done work outside of a lab and in more of the nutrition program space, you know that doing this work in real communities and collecting data has its own intricacies. The setting itself is different, the people, the workflows, language is sometimes different, the environment is really different than in a more of a controlled lab setting or a clinical setting. After explaining all that, I know that was a very long introduction, but I want to make sure folks understand what the device is itself. After, realizing that this is a, real desire from a lot of practitioners and researchers about how exactly to use this device with best practices, we thought, let's ask all these folks that we're working with about how they use the Vegimeter, how they adapt it based on the protocols that are available in the world, and try and identify some best practices and some context-specific adaptations that we could share through JAMD.
Very nice discussion on the study and some of the study results. I'm wondering, how might a registered dietitian nutritionist use this information that you've taken from your study with clients?
Yeah, so if there's a registered dietitian nutritionist that's working in a community-based setting that has an intervention where the intervention focuses on fruit and vegetable intake and there's some measurement around that intervention, the Vegimeter is definitely it would be a well-warranted device to explore for use. And this article really walks through the specific adaptations that the survey and interview participants identified as important when thinking about going into a community-based setting. So things like making sure there's a hand washing station available for participants before they put their finger into the Vegimeter. There's really practical tips around warm up and calibration procedures for the device. Thinking about having, if you're going to be outside, having a tent so that the device isn't getting too much sunlight exposure on it. So there's some really practical considerations to think about when using the Vegimeter as a measurement tool in a community-based setting. And I think that this article can really help someone think through how to set up a protocol that will really work for the location that they're in. There's another piece that I want to highlight is like participant receptivity to the device can be a range of feelings, which we really learned. And I think a registered dietitian nutritionist would want to be prepared for in practice. Some folks can feel really excited about the device, and others can feel a little nervous, like, what is this black box that I have to put my finger into, and is it going to hurt? And so we provide some perspective around that and how to make participants feel comfortable, reduce their anxiety, and improve engagement. We also have some ideas around how to report results back to participants, and thinking about making participants feel like this is a measure for you and change is different for every person, and really helping it to guide their own nutrition practices and fruit and vegetable intake.
Thank you. So interesting. And my thought is that this could be of great importance to dietitians, either working in a research setting or, as you've just described, possibly in clinical settings. So very important way of looking at carotenoid consumption, and certainly less invasive than a blood draw, for example. And that in itself is a positive. So many, many thanks for the work you've done in this area and for your description of the study and how it might be used by the RDNs.
Yeah, I appreciate the interview. And if folks have have questions or want insights, I'm always happy to meet. So please feel free to reach out and think about how it could be used in the work that is being done.
Thank you so much. I so
Great.
appreciate both your article and your willingness to participate in this podcast.
Great. Have a nice day.
Thank you for listening to our discussion today. Additional scholarly articles related to today's topic are available on our website at www.jandonline.org. If you found this discussion informative, please like the video and subscribe for more content. Thank you for your time and support.